Hello, I'm Dr. Ryan Kazemi. Dental implants are now considered the standard of care by many clinicians for replacement of missing teeth. Now, when we are faced with the replacement of missing upper back teeth, one potential challenge may be the position of the sinus, which may limit the available height of bone. So in some circumstances, it may be necessary to perform a minor bone augmentation to restore the height of bone and in order to allow support of a proper dental implant. Sinus lift bone graft is a relatively minor procedure and in many ways less traumatic than even a removal of an impacted wisdom tooth. Now, there are several techniques and approaches that are available based on the degree of sinus lift augmentation. And with proper techniques, protocols, and materials, they can be performed quite safely with minimal risks for complications. Let's take a look at a patient and demonstrate how placement of a dental implant and a sinus lift bone graft can be done in a single procedure that takes less than 30 minutes to perform with optimal accuracy and success, while keeping it quite conservative to help patients with a rapid recovery. The first step is accurate assessment of the bone and the position of the sinus, which is done with a cone beam CT scan. Then, a digital impression is done, which is merged with the CBCT and is followed by a computer-assisted implant planning in order to predict the precise position of the implant, its length, the width, and also the amount of vertical bone augmentation that's necessary to support it. The position of the implant is then translated to a surgical guide design, which is fabricated on a 3D printer, and then it's used during placement of the implant for optimal accuracy. The next step is an incision and the development of a flap in order to expose the lateral aspect of the sinus area and the site of the implant placement. Then I use the lateral sinus lift rotary instrument to gently thin out the bone over the sinus area, while taking great care not to perforate the membrane beneath it. Now we use several sinus lift specific instruments to gently lift the membrane, creating a tent area where the implant will be placed. This is a small area of sinus lift and bone augmentation, and it will not impact the health and function of the sinus at all. The membrane is completely intact, as demonstrated here by its movement during the inhalation and exhalation. Now I'll place our 3D printed surgical guide that translates the precise position of the implant as it was designed on the computer model. We'll start with our initial site preparation and then continue it using an Osseodensification technique. This allows the compaction and elevation of the bone rather than its removal, which happens with the use of regular implant drills. Osseodensification allows us to increase the bone density and hence the primary stability of the implant, which is crucial for proper healing. The implant is then placed using the surgical guide and sleeve. I first position the implant only about halfway at this point, and then complete its position once the bone graft material has been placed. The particulate bone graft material is packed into the created sinus lift space. And once completed, I then rotate the implant further into its final position. This helps to prevent areas of void during the bone graft, which can happen if the implant is fully seated at the beginning. I'll place the cover screw on the implant with plan to leave it submerged during its healing. And this is important in order to avoid any micromotion on the implant that can compromise its integration process. We'll then add the final bone graft material and cover it with a resorbable guided bone regeneration membrane. And finally, I'd reposition the gingival flap and suture it using resorbable suture material that typically resolves in about 7 to 10 days. And here are the digital radiographs showing the desired position of the implant as well as the amount of the augmented bone. Patients usually experience some level of discomfort, which are relieved quite well with over-the-counter pain medication such as ibuprofen or Tylenol, as well as some swelling that resolves mostly in 7 to 10 days. I generally wait about 6 months of healing in such cases in order to allow the adequate bone healing and the implant integration. Then at that time, we'll uncover the implant and prepare it for the final impression and restoration. If you have any questions or want more information about this treatment, please let us know. We're here and happy to help. Thank you.